Our team coverage starts with Cornelius Hawker with a look at what families should keep in mind about COVID-19 vaccines and children.
This is one of the only things getting Tiffany Fincher and her husband Ben through these challenging times.
We now have a newborn and kind of just living a wonderful life. Never been happier.
Being forced to keep to themselves because of the pandemic worked the first month of their new baby's life.
Nobody was going to question why we didn't want them and friends and anybody around.
But now
We're to the point where in a regular year, we'd probably be sharing him a little bit more with everybody and having a couple friends over, at least some close family.
For parents seeking a sense of normalcy, Dr. John Christensen with Riley Children's Health says it's important that adults get the vaccine when it's available because for now, it will not be available to kids.
These vaccines are well studied, and I think the data will show that they're pretty effective and safe.
Despite that, Dr. Christensen knows parents have questions about vaccinating their children. We can know much more in the coming months.
Some people have predicted that probably you're not going to see widespread vaccination in young children probably into the summer.
The doctor says there are lots of variables and the vaccine will be studied extensively before given to kids. For parents worried about side effects, he says the most common will be potential pain where you get the shot, muscle aches, fatigue, and in some cases, a fever. But he stresses this point.
They have nothing to do with getting COVID from the vaccine. What they are is your own immune response responding to this substance that you're injecting into the arm.
When it is offered freely, hopefully by that point we'll have more information and we can make the right decision. We will want to take it.
Tiffany and her husband want to take it to protect their family and start getting back to normal. Working for you, Cornelius Hawker, WRTV.
There are also a lot of questions about women who are pregnant getting the vaccine. That's a conversation they are urged to have with their doctor because currently there's no data on how safe vaccines are for those who are pregnant.